Heyo, Shiloh here with the 25 to Life prison vlog series. Um, if you like these videos, please give it a thumbs up. Don't forget to subscribe because I'm telling you the stories are going to get juicy. It's prison life. It's got to, right? Um, Basically, though, it's just me getting things off my chest after working in a prison 25 years. But people can go 30. It's your 25 to life sentence, except unlike an inmate, we have our freedoms after 8 hours. We get to go home and be with our families. They don't have freedoms. So their liberties are gone. And when they do 25 years, they're stuck in one place for 25 years. All right. So don't forget to subscribe, set your notifications to all, and I will try to keep these videos in a sequential order under the playlist 25 to Life vlog. And where we left off, we were talking about the nurse administrator, and she was telling another nurse about how Nurse Daisy and I had said things about her, which wasn't true. She came out of the nurse's office, the supervisor's office, screaming at us. The nurse administrator followed, kind of smirked and giggled and had no answers when she said, what did we say? What did we say? She had nothing. So it was just like her way of having fun on our behalf. And my puppy's going to be right below me. So, but like I said, the doctor at the prison was also involved in this love-hate relationship with other nurses, and she was absolutely out of her mind. She would verbally abuse us and physically, and she would do stuff to try and get us in trouble on purpose. It's like, you know what? Life is so freaking short. Why are you causing trouble? Just let us do our job. We were a well-oiled machine. We did our job. We made our medical unit look good. We made the prison look good. We passed all our audits. Leave us be. Let us do our job and appreciate it and say, hey, thank you. Do some constructive criticism. We are keeping everything running smoothly, so your job is easier. You know, the people above you, their job is easier. It makes our life easier. Our day goes by. Just let us do it. We are already in a stressful situation. We come to work every day not knowing what's going to happen, what's going to go down. There are, in our prison, there was anywhere from 500 to 700 inmates, depending on what year it was. And it's not like they're in cells. This is an open compound. It used to be a boys' school, a tuberculosis hospital. So it's an open compound. There's inmates walking everywhere. They walk into your medical unit. They're not escorted. They're free to be. They sign in. They show the officer their ID. They're just there. When we interact with them in an exam setting, they're right there with us. The officer's outside, within ear's reach, but they're not with us. So we're already in a subconsciously stressful situation because you're always watching behind your back and thinking, what if? So you're always on point subconsciously while consciously doing your job. So why throw kerosene on a fire when just let it be? So this medical director was actually new to the facility because our old medical director had retired and we were in transition. So she had come on board from another prison. I know in the past she had disciplinary issues, but she was out of her mind. So one day, I'm sitting at the computer doing, because our medical charts are paper charts. They're old-fashioned. They're not digital yet. But when we enter information into the computer, it's because an inmate needs to go to an outside doctor. He has a procedure pending, stuff like that. Well, we also started putting in doctor appointments in the computer. So if the inmate has to see the doctor at the jail that day, he gets a doctor appointment scheduled in the computer. It's just so much easier to track where he's going, what he's needing, what he's doing in the medical situation. So we could pull up an inmate on the computer, see if he has a doctor appointment. a blood test, an x-ray, a consultation, a surgery. It's just so much easier to track everything. So the doctor is not always at the facility, and she called out sick a lot, and she's part-time, and it's one doctor with all 600-700 inmates, so she's overwhelmed, and there's a lot of work for her to do. So she would ask us to help her input medical consults into the computer. Now, a nurse can put a doctor appointment, a lab, an x-ray, things like that a nurse can do. The nurses cannot put a consult into the computer because it requires a medical diagnosis. And nurses cannot diagnose inmates. Nurses can't diagnose patients, period. Only a doctor can. We can assess, gather information, document, and give it to the doctor, but we cannot diagnose a patient. You're just not allowed. It's illegal. So the doctor, the medical director, overwhelmed, needs help, would occasionally come to the nurse's station, say, how do you do this? Can you help me with this? And we'd help her put consults into the computer. Now, on one occasion, she and the per diem nurse came into the nurse's station and asked about a consult. Now you put the consult into the computer, and it goes through a process where Albany, it's like the managed medical care, like your health insurance has to approve an MRI or a CAT scan. It's the same philosophy. You put the consult in, it goes to Albany. Albany has a managed care team. They look at it, they approve it. That way the bills get paid. Okay? So she was having a hard time with this one consult. She'd put it in. Albany would say, no, do it again. Put it in again, tweak it. No, do it again. She was having a hard time getting this consult approved. And if it doesn't get approved, it gets denied. And then the inmate doesn't have the procedure, the test, the doctor appointment, whatever it is. So she was having a really, really hard time. So she finally came back out to the nurse's station, and this has been going on off and on for a few days. She's like, I can't get it to work. Can you help me? I said, we're not allowed. If I put it in, I'm going to get in trouble. And I say this because I know her, because she's such a backstabber that I know if I do something, I'm going to get in trouble. It was almost like she was trying to reel me in to get me to do something that she knew I'd get in trouble. So she stands there at my shoulder. We're looking at the computer. I go on to the inmate. I pull up his ID number, and I'm looking at it. I'm like, well, I don't see what you did wrong that they shouldn't approve it. So she said, well, maybe I should try a different diagnosis. I'm like, well, what would you put? Because whatever you have seems perfect. So she said, well, delete this and put this. So I deleted it. Now, mind you, my dumb ass, it's my computer, my logon, my credentials. So when Albany pulls it up, they're going to see my name and like, why is a nurse doing this? So not thinking, because she's right there, I changed one word. Now, if she had gone into her office, pulled it up and changed another word, it would now be on her login. If Nurse Daisy pulled it up, changed a word, it would be her login. So the last thing that was entered at this moment was my login, because I'm helping the doctor. So it gets approved. It finally gets approved. Now you know where this is going. I know you know. So, dun dun dun. I get an email. I'm like, what the beep? I get an email, and I'm going to read it to you. Shiloh. After reviewing the policy about medical consults, Dr. Bleep, he is the head medical director of the entire Department of Corrections, has stated that no one except a doctor can enter a consult. Please make sure you do not enter any consults, even if you're trying to be helpful. Thank you. And that's from the medical director. So I blow a gasket. I'm like, you gotta be effing kidding me. All right. So I reply, Doc, the only consults I entered were the ones you asked me to do. Correction. The only consult I entered, correction. And I'm writing it like this. The only word I entered was a word you asked me to do the other day when we were trying to get a consult to be approved. From now on, if you need assistance, please do not ask me. See the nurse administrator. So then the nurse administrator chimes in because I CC it to her because she's my immediate supervisor. She says, I can't do it either. The policy states that nurse administrators cannot enter consults, only doctors. And so then I reply, well, in short, please do not ask for my assistance, and then send an email saying not to enter a consult, even if being helpful. I will not enter any more consults per your direction per any policy. I will not make corrections to any consults per your direction per the policy. Other doctors do not have computer access. A nurse working with that doctor is allowed to enter their consults because they do not have computer access. This particular instance is approved. So having a nurse do it for the doctor, since she cannot go onto the system, is allowed. So that other doctor that there's another doctor that comes in, she only works 2 evenings a week for like 3 hours. She does not have computer access because she is not a full-time employee of our prison. She belongs to Sing Sing prison. So because she works at Sing Sing and not Otisville, which is the prison I worked at, she cannot use the computer access there. So the nurse working with her had special approval to enter everything under the nurse's login with the doctor there. That was the only instance that it was allowed. So then I send this email off to the doctor who's in her office, which is 10 feet away. So I send off the email, don't ask me anymore. I'm not going to do it. I don't want to get in trouble. Just don't ask. You know, if you need help, I will verbally help you. You know, I was very clear as to what my role was and what my role is allowed. I'm not going to get in trouble. I refuse for no one. The doctor doesn't pay my bills. The other nurses don't pay my bills. I pay my bills. And my paycheck is my paycheck. And I'm going to do what I need to do for me. And I hate to have that mentality because when I go to work, you know, if the other nurses need help, I want to help them. I know my job, and I'm not patting myself on the back. I know my job. I've been there many years. I know the system. I know the computer. I know what to do. So if somebody else needs help, I want to help them. I don't want to be, sorry, can't help you. You know, we want to create that well-oiled machine and keep it running. So anyway, the doctor comes out of her office after I send off this email. It wasn't right away, maybe an hour and a half. She comes to the nurse's station holding the email, so she must have printed it out. Hi, my darling. What's the matter? You want to say hi? Say hi. So she comes out to the nurse's station with the email in her hand, stands behind me, takes her hand, the other hand. So say she's got the email in her right hand, she's got her left hand. I'm sitting right here. She comes behind me and smacks me up in the back of the head. Physically smacks me in the back of the head. And Nurse Daisy's sitting right next to me on her computer. She looks at me, I look at her. And then the doctor walks out. I'm like, okay. So another email goes out to my union rep about the doctor hitting me in the back of the head. Granted, she didn't hit me like with a closed fist, but she smacked me pretty hard that I went forward like that. So another email, just so you know, this is what the doctor did. I wrote it in my journal. I'm just documenting it to let you know so it's on the record. I know nothing's going to happen because this is our department. Nothing happens. But You don't put your hands on me. I don't care what the reason is. If I'm in a physical fight with you, which hasn't happened since 8th grade, I think. If I'm in a physical fight with you and you're defending yourself, by all means, put your hands on me. If I'm at work, don't put your hands on me. Don't put your hands on me anywhere. It's not right. You don't touch people like that. You know, you want to shake hands or give someone a hug, by all means, knock yourself out. But do not put your hands on people like that. And that's what she did. So she leaves, goes to her office, comes back. I know, darling. Come here. Comes back about 10-15 minutes later. I don't know what she was doing. Maybe making a phone call to make it seem like I did something wrong, that she had to put her hands on me, which there's there's nothing you can do at work to allow someone to put their hands on you. But anyway, she comes back out and she says, like nothing happened, all happy. Well, by the way, you need to do the flu clinic and get it done. We're supposed to have so many inmates vaccinated against the flu before this date. And I think there were maybe 100 more to go or something like that. And you can't just give an inmate a vaccine. You have to bring them down, show them information about it, ask them if they want to take it. If they say yes, you give them the vaccine. If they say no, they sign a declination and a refusal saying I didn't want it. It has to be documented in their paper chart. So for one inmate, there's a lot of work involved. And now we're talking over 100 inmates. So she wanted me to set up the flu clinic so we could finish getting these inmates vaccinated. I'm like, no problem. You got it. Now remember, when someone tells you to do something and they are of a senior position to you, you have to do it, or it's insubordination. Now, if my supervisor, who's right above me, and the medical director, who's above her, both give me orders, I have to go with whoever gave me the last order. And if my nurse administrator said, tomorrow you're going to accreditation, and then the doctor comes and says, no, you're going to do a flu clinic, I have to do the flu clinic. So that was the case. I had to do the flu clinic and get 100 inmates to either decline or accept a vaccine. So I was in charge to do this flu clinic. So I got a hold of the infection control nurse because there's more to it than just having an inmate come down, asking him some questions, and getting him to say yes or no. You have to run a list of priority inmates, like someone with HIV, asthma, cancer. They're priority, so they get asked first, and then you go down the list, and then obviously the healthier, younger inmates would be asked last. And the reason for this is because we only have so many vaccines. So I printed the list, and it came up with 300 inmates who had not yet had the flu shot. Not 100, 300. And of the 300, I would say 80 of them were high risk and really needed it. So you had to break them down, put the high risk, set up a clinic, get the inmates down, ask them the questions, give them the refusal, or do you want the shot? Give them the shot, and on for over 300 inmates. So it had to be a well-coordinated machine. It had to be on a day when there was extra nurses at the medical unit, because if I'm doing flu shots, we need another nurse to run the infirmary, maybe another nurse to do the medications. We needed help. You can't take one nurse out of the medical unit to do a special job and not have someone there to fill her job or his job. So this was going to be a task. And like I said, 300 inmates. So I had to group them in a certain amount, do certain days of the week. There was no way I'd do it all in one day. And I think Wednesdays was the best day because we didn't have doctor appointments. There were no medical trips on a certain Wednesday because it was a training day. So I would say maybe Wednesday, I know, this week do 30. And then the following Wednesday do 30 for like 10 weeks straight or whatever it was. Maybe it was a little bit more than that because they wanted to get it done. So I set up clinics, A couple times the infection control nurse would said she'd be there to help me so we could get it done. Now, in the meantime, we also have accreditation going on, and like I said, the doctor told me to get the flu shots done because somewhere, some way, somebody was probably pressuring her to get these inmates vaccinated because it was probably in the heart of flu season. And inmates will complain. They will complain about everything. If their peanut butter is too crunchy, if it's too creamy, if they got a vaccine, if they didn't get a vaccine, if we're not giving them vaccines, it's because we want them to get sick. If we give them a vaccine, it's because we're experimenting on them. So it's always a conspiracy. But either way, somewhere, somehow, somebody said, get these flu shots done. And this was per the direction of the medical director. So we had completed almost everybody within a time frame. So I think I had one more clinic left, just one. And my nurse administrator said I was supposed to go do accreditation. Leave the medical unit, go do accreditation. Well, the doctor told me, nope, you're going to do flu shots. See, I told you. So then I get a nasty email from the nurse administrator. And that's where we're going to leave it until the next time. And then you're going to find out what happened after that. I'm telling you, these stories may sound like me just complaining and bitching. It's going to get juicy. There will be stories about inmates and other nurses and other prisons and my dog barking at me. Just kidding. So stay tuned. Don't forget to subscribe. If you like these videos, give it a thumbs up. If you have questions, ask them below. I will answer them to the best of my ability. No names because everybody's guilty. Just kidding. Innocent until proven guilty. So until next time, I will see you.